Hi, this is Andrea Fava coming at you for Room Now here at ACR in Washington, D.C. And I wanted to talk about what I think is a fibroblast renaissance. In the last few years, this cell type that we kind of ignore for the many years is coming in everywhere. We are discovering its role in multiple autoimmune diseases and also discovering new roles because we think that yes, it's a cell that makes collagen and drives fibrosis, but there may be more than that. And the first abstract I want to comment on is an abstract presented yesterday at Plenary 1 by Angela Zhu from the Brigham. And they did a fascinating study. In fact, it was a plenary, and studying the fibroblast cells in the synovium of rheumatoid arthritis. A couple of years ago, our group, as part of the Accelerated Medicines Partnership, found that there's a group of rheumatoid arthritis patients that are refractory to treatment that actually have fibroblasts that are inflammatory and then can drive disease. But now they try to understand more about this, and what they found through a very elegant system is that if you have an inflammatory fibroblast, that can be driven to become an invasive fibroblast that then can cause damage and affect the cartilage. And this is fascinating because they were able to identify the transcription factors that drive this transition, and perhaps that can drive the design of new treatments. The other abstract I want to highlight was presented today by Jasmine Sweater from NYU, and that's about lupus. And they have presented last year, and the paper is in preparation, a study focused on in class 2 lupus nephritis, which is the underdog of lupus nephritis. Milder, sometimes we don't pay enough attention to it, but it's the very early stage of disease. And what they found by using single-cell RNA sequencing of the kidney is that myofibroblasts actually are incredibly increased in these patients as compared to all other classes. And so now they studied the urine of these patients, and they found that actually there is a strong signature of fibroblast activation in these patients, confirming the signature in the kidney, bringing our attention to the fact that these important cells is also implicated in lupus nephritis. So with this renaissance of information, hopefully we're going to have treatment that can treat the inflammation driven by fibroblast and perhaps even prevent fibrosis and with that chronic damage. And for more information, you can go on Room Now on the website. Thank you and bye-bye.